Now, once that appointment is finished, then all of that information gets sent over to our physics team. And our physics team takes it truly from that day and starts designing your treatment plan. So our dosimetrist will take it first, and they will review your CAT scan images that we took here in our department, and they may ask for previous CAT scans. They may ask for MRIs. They may ask for PET scans. And they're going to look at all of those imaging studies and what we call fuse all of those studies on top of each other. And on the computer, they're able to look at all three image sets at the same time and look at where the cancer is and where the healthy organs are around that area. Now, I often get asked, I've had my tumor removed, how do you know what you're treating? So we will ask for previous imaging studies to see where the cancerous area was and look at your anatomy now, post-surgery. So our dosimetry team is really able to focus on your anatomy pre-surgery and post-surgery to ensure that we're treating the correct areas and avoiding the healthy tissue around it. Now, radiation therapy has changed so much in the last 20 to 30 years. Even in the 8 years that I've been doing this, the advancements in technology are astounding. If you had asked me 10 years ago when I was in school if we were going to be doing the things that I'm doing now, I would have said absolutely not. The things that we can do for our patients now that we couldn't do before are truly amazing. If you know someone who had radiation therapy 20 years ago, we didn't have the technology that we do now, so their experience will be different than your experience. One of the technology advancements that we talk about a lot is really done within the treatment machine. Years ago, we didn't have the ability to shape the beam of radiation. We didn't have the ability to protect the healthy tissue. So if someone in your family had had prostate radiation 20 years ago, we would create a rectangular shape of radiation and deliver 4 beams. That's all we had the capability of doing. The patient would receive treatment from the front, from the back, and beams on each side. And what would happen was all of the tissue in that radiation field would get the exact same amount of radiation exposure. The prostate, the bladder, the rectum, all of it was getting the exact same dose. Now what was happening was our prostate patients, they would have 2 weeks of treatment. They'd have bladder spasms, diarrhea, nausea, because the bladder and the rectum are exceptionally sensitive to radiation, and the prostate needs a lot of radiation in order to get rid of all those cancer cells. So our men would have to have a long break to alleviate these side effects from radiation and let the bladder and the rectum truly heal from the effects of what we were doing. Now, biologically, if you think back to the beginning of these cells replicating, that did have an effect on the prostate cancer. So the men would have relief from their side effects, and then they'd finish their course of treatment. Now we have the ability to not only see the prostate during your radiation treatments and determine exactly where it is, but we're able to shape the beam conformally to the prostate 3-dimensionally. So we can not only look at the prostate right before we beam on, but we can also make sure that the shape of the radiation is matching that 3-dimensional shape of the part of the anatomy we're treating. Because we have the ability within the machine to do that, we have these little, we call them leaves, and they just move independently to create this 3-dimensional shape of radiation. Now also we have this technology called deep inspiration breath hold. Now we use this a lot on our breast cancer patients, most often on our left breast cancer patients, but sometimes on our right-sided breast cancer patients as well. Deep inspiration breath hold came about, I would say, 7 or 8 years ago, and what we used to do with breast cancer treatments was treat the breast and the whole breast, and we still do that. But what happened 10, 20, 30 years ago with breast cancer treatments was we were treating part of the heart, and there was really no way to avoid that. We know that the heart falls to the left side of the body, and there was no way to avoid delivering radiation to the heart. Eventually, we discovered was that when you take in a deep breath, your heart actually moves out of the way. It centralizes and slenderizes. And so in this image here, you can see that the previous way that we used to do things, some of the heart was getting treatment. And now, while our patients take in a deep breath, the heart moves out of the way. Now, we use this for a lot of our lung cancer patients as well, and we use it for abdominal cancers. And it helps with tumor motion. Now, how do we do this? How do we know how much air you're taking in? How do we know your heart is out of the way? Well, we have these little boxes, and this box sits on your belly, and it monitors your breathing. And you'll hear the therapist say, when you're ready, take a deep breath in and hold it. And we will be able to see how much air you're taking in. And we'll capture that image in the CAT scan planning session. Then when you come for treatments, we will put that same box on your belly. We'll tell you, take a deep breath in and hold it. And if you've matched that threshold of the correct amount of air, the radiation turns on. Now, if you decide to be a rock star and overshoot and take in too much air, the treatment machine will say, oh, that's too much. The heart's not in the right place. So the radiation machine will not turn on. And if you don't take in enough air, or you cannot hold your breath during the treatment, the machine is monitoring you, and it will recognize that you've let your air out and you're no longer within that correct range, and the machine turns off. So it's also a safety feature that we have to monitor your breathing. So that's one of our newer technologies that really allow us to give more radiation to the part of the body that needs it and really limit the exposure to the healthy tissue.